Hello everybody. Do you know that dental decay is one of the major causes of dental complications, and it starts gradually unnoticed to the person, okay? So in this video I'm going to talk about dental decay. I'm going to talk about tooth decay or dental caries as we call it. I'm going to tell you the causes, the types, the remedies, the classification, and every other information you need to know. So please, I would love you to stick with me and watch this video to the end. Okay, now first of all, what is tooth decay or dental caries? Now, tooth decay or dental caries is a bacterial infection that reduces the strength of the tooth enamel, thereby leading to holes and discoloration. Okay, it is a bacterial infection that leads to the demineralization of the tooth enamel. That long word I said, it simply means reduction of strength. Okay, it reduces the strength of the enamel and thereby leading to holes and discoloration. It is very common in many people, and sometimes it even starts unnoticed. You don't notice it. Okay, so as I said earlier on, I'm going to tell you everything you need to know about dental caries. Now, first of all, what are the causes of these dental caries? Okay, now the first cause of dental caries is the bacterial activities inside our mouth. There are harmful and beneficial bacteria in our mouth. The harmful bacteria helps in breaking down food substances and kickstarting the digestion process, okay? Whereas the harmful bacteria are the ones that cause these tooth decay we are talking about. So the bacteria in our mouth cause tooth decay. Now, the next cause of tooth decay could be the diet, the food we eat. Okay, if you are used to eating sugary or acidic food, there is a high tendency that it can cause tooth decay. Why? Because this acidic food and sugary food react with the bacteria in our mouth, and then they cause tooth decay. Just like the way metals used to rust, that's how the teeth will start reducing in strength. The enamel of the teeth will start reducing in strength and then leads to tooth decay. Poor oral hygiene can also lead to tooth decay. When you don't brush your mouth regularly 2 times a day as we advise, you don't floss your mouth regularly, you don't visit the dental clinic, you don't do what we call the scaling and polishing, and you are into practicing some bad oral habits, yeah, definitely you are exposed to having tooth decay or dental caries. Time also is another factor. Okay, when you don't maintain good oral hygiene and then the bacteria in your mouth keep reacting, and then you eat foods that are unhealthy for the teeth, yeah, definitely you are exposed to dental caries, because as I said earlier on, it starts in some people without them knowing. It starts in a person's teeth without him knowing. Before you will know, the thing has gone far and gone far, and then it has done the damage already. Okay, so time also is a cause of tooth decay, negligence over a long period of time. Okay, we have other factors that can also lead to tooth decay, and these factors include genetic factors, dry mouth, and inadequate fluoride. Okay, when you are fond of keeping your mouth dry, you don't hydrate your mouth properly, and then maybe there's a genetic factor, and then there is an inadequate supply of fluoride in the food you eat, the water you drink, and all of that. It can lead to tooth decay. Okay, now let's talk about the types of these tooth decay that we just mentioned. Okay, now we have what we call the teeth and fissures tooth decay or dental caries, which often appears on the occlusal surface of posterior teeth. Okay, now this occlusal surface simply means the surface of the teeth that is responsible for grinding of food, especially the posterior teeth, which is the molar and the premolar. Okay, so this teeth and fissure tooth decay is found mostly on the occlusal surface of posterior teeth. We also have smooth surface caries. Okay, these smooth surface caries appears on smooth surfaces like the labial aspect, the lingual aspect of the anterior teeth, and all of that. This type of tooth decay appears only on smooth surfaces. Now, we also have what we call the root caries due to gum recession. Okay, now gum recession, I mean, there is actually a particular point where your gum should cover your teeth. Your gum should cover the root part of your teeth and leave the crown, okay? But when there is a gum recession, your gums goes below the root and expose that part of the root, okay? And then the root now, if you don't take good care of your teeth, if you don't practice good oral hygiene, the root will get infected and start to decay. This is what we call the root caries. We also have what we call the early childhood caries, or ECC, okay? Now, this early childhood caries, as the name implies, is often found in children, mostly in their primary dentition and their early permanent dentition, okay? Because of poor oral hygiene, because of all the causes I mentioned, we have the early childhood caries. And then we have what we call the rampant caries, okay? The rampant caries is also another type of dental caries or tooth decay. Now, let's go on to the classification of tooth decay. What are the classifications of these tooth decay or dental caries or tooth hole as it is generally known? Now, we have classification based on location. And under classification based on location, we have the smooth surface caries, we have the teeth and fissure caries, and then we have the root caries, as I've mentioned earlier on, okay? The teeth and fissure caries appears on occlusal surface of posterior teeth, whereas the smooth surface caries appears on labial and lingual aspects of the teeth. And then we have the root caries, which I said appears on the roots of the teeth, okay? Now, we have also the classification based on severity, okay? And then in classification based on severity, we have the incipient caries, we have the moderate caries, and then we have the advanced caries. As the name implies, the incipient is the beginning, the moderate is when it is a little bit advanced, and then the advanced is the complicated form, okay? Now, classification based on activity, okay? We have active caries, and then we have arrested caries. Active caries is when the caries or the tooth decay or the tooth hole is increasing, and then arrested dental caries is when the tooth decay started but it has been arrested or it has been stopped. Now, we also have the classification based on duration, okay? And in this classification, we have the acute dental caries, and then we have the chronic dental caries, okay? The acute dental caries is actually very fast in progression. That means it grows faster, the tooth decays faster, while in chronic tooth decay, it is a slow progressing tooth decay. Now, what are the solutions for these dental caries that we've talked about? Remember, I said it is a very common case and it starts small, small, unless when arrested. All right. So now the prevention for tooth decay. If you want to prevent tooth decay, the first thing you have to do is maintain regular brushing and flossing. Okay. Make sure you brush your teeth 2 times every day. Make sure you floss your teeth as regularly and as often as possible. Okay. Make sure you brush your teeth and floss your teeth in order to avoid tooth caries or tooth decay. We also have the fluoride treatment. When you visit your dentist, we'll do what we call the fluoride treatment. This is the application of fluorine on your teeth just to increase the strength of the teeth. Okay. Remember, in the causes of tooth decay, I said inadequate fluoride. So if you want to increase the strength of the teeth, you add fluorine and it will make it stronger. Now, we also have the use of dental sealant. This is also a dental procedure and you have to visit the dental clinic for that. The dental sealant will help to prevent dental caries. Then last but not the least, and a very important part of the prevention for tooth decay is that you should monitor your diet. Monitor the food you eat. Avoid eating sugary food, avoid eating acidic food, avoid eating sour food, avoid eating food that you know will lead to tooth decay, as I've just mentioned. Sugary food, acidic food, avoid eating them. Why? Because they react with the bacteria in your mouth and then they lead to tooth decay. Okay, if you do all these things, I'm very sure you are not going to have tooth decay. Now, peradventure, you already have the tooth decay. Your teeth is decayed. When you look into the mirror or when you visit your dentist, they tell you that you have a tooth decay and you are wondering what is the solution. We have various solutions for tooth decay. Okay, now the first solution for tooth decay is the filling, tooth filling. Okay, you can visit your dentist and then we'll do what we call the tooth filling. In the tooth filling, we are going to fill up that part of your teeth that is decayed, or that hole that is created by the bacterial activities in your teeth. Okay, so we're going to fill it up with either amalgam, with composite, and other filling materials. When you visit your dentist or your dental clinic, you will have it done. Okay, and then we have the fluoride vanishes or gels. Okay, you can visit your dental clinic also for that. It's just like the fluoride treatment, but this one is going to be more intense, so as to properly care for the teeth that is decayed and prevent further decay. Now we also have the dental restorations. Dental restorations for dental caries, simply talking about the inlays and onlays. Okay, the inlays and onlays are there to fill up that part of the teeth that is decayed. The inlay, are going to, if for the inlay, we are going to put the filling material inside the hole, while for the onlay, we are going to put it on the surface of the teeth to arrest the decay. Okay, and then we also have the root canal therapy. Okay, we have the root canal therapy or root canal treatment. That is when the decay has affected your pulp or your root canal. Remember, in the structure of the teeth, there is this tiny hole inside where blood comes in and goes out. So if the tooth decay has affected that part of the teeth, we are going to do what we call a root canal therapy. And then lastly, but not the least, the solution for dental decay or tooth caries is tooth extraction or exodontia. This is when we remove the teeth, and this only happens when the teeth is badly decayed beyond repairs. Okay, when your teeth is decayed beyond repairs and there is actually no solution that is going to be of help, we have no option than to remove the teeth, and we don't actually like it. Okay, so in order for you to avoid losing your teeth, please make sure you brush your teeth regularly. Visit your dentist 2 times in a year. Brush your teeth 2 times every day for 2 minutes, and then make sure you floss your teeth as well. I hope you find this video interesting and educating. My name is Joel Jethro, and I'm happy to have you here. Please, I would love you to give us a like, share, comment, and subscribe if you enjoy this video. Thank you, and see you in my next video.